How do you turn the music off?
It's just playing for now. It will turn off when the competition begins.
I, for some reason, can't find. Oh my God! I finally. Is it me? Can you hear me?
We can.
Nope.
Hello, everyone, and welcome to the 2021 edition of the Ontario Medical First Responders Competition. On behalf of the Chancellor, Elaine Lawrencell, the Priory of Canada, and on behalf of St. John Ambulance Council for Ontario, it's my pleasure to welcome you as you demonstrate your skills of applied first aid in a uniquely competitive environment. My sincere appreciation is extended to Paul Sims, the chair of the competition committee, and his entire team who've worked so diligently within a constrictive environment to provide you a safe and hopefully enjoyable venue to demonstrate your skills. I am sure that many of you have participated in our COVID response in Ontario, whether at food banks, delivering protective equipment, staffing COVID or vaccination centers. Your efforts are making a difference. You are amongst St. Johners around the world who are carrying on nearly a century of humanitarian service under the 8-pointed White Cross. For all your efforts, we extend our most sincere gratitude. Today, you'll have an opportunity to participate in an ingeniously modified program that will not only allow you to demonstrate your individual skills, you will still feel the rush of the competition as you pit your knowledge against that of your peers. Friendly competition is an excellent way to challenge us all to achieve greater competency in responding to real emergencies. You know, over 30 years ago, I chaired this very competition committee, and I know it's likely before some of you were even born. The competition's come a long way in that time, and you are the next generation of St. John leaders that will keep us relevant for the next 30 years. Once again, my most sincere congratulations to all of you for your dedication to St. John and Ontario, and staying home with a prize or not, you are all winners this day for St. John. Have a great competition.
Hello, and welcome to the competition. Over the past 30 years, I've been a competitor, coach, judge, and organizer, and I'd like to recognize the work of the organizing team. On behalf of the competitors, thank you for your creativity and continued efforts to challenge us and help us learn. Competition is a fantastic way to practice our skills and challenge ourselves to improve. This has been a year where many St. John members have explored new ways to engage with each other and their communities. This has included supporting COVID screening and isolation sites, creating new virtual training opportunities, doing virtual visits, filming YouTube videos, and the list goes on. This competition is yet another example of that ingenuity. If you have new ideas and ways to support each other and your communities, please connect with your branch. Continue to follow the direction of the Public Health Advisory Task Force, who will continue to guide our training and service activities. Enjoy the competition, good luck, and have fun.
Hoping that everybody that was planning on attending is here. So my name is Sandra Ladd, and I am the Chief Judge for the Ontario Medical First Responder Competition. Again, welcome. In your chat, I have put the Kahoot PIN number. So what I need everybody to do right now is we're going to play a practice round just so you can understand how Kahoot is going to work. You're going to use your own device, and you're going to either open up a new screen on your laptop or whatever you're using, or you're going to use a phone as a secondary device and open up a web browser and go to kahoot.it.
You haven't switched your video yet, Sandra.
Sorry?
You haven't switched your video yet.
I know I haven't. Kahoot.it. So if everybody can look in the chat, the PIN number is in there, and I'm going to share my screen now. We just don't want folks from the internet joining. So the PIN number is 252-2642. 252-2642. So from the internet, we are currently live streaming, and it's about 30 seconds behind. So I need to see how many people are going to attend. So please remember that when we're actually doing the competition, I'd like you to put your full name. That way we can identify who everybody is. This is just a practice round. So we're going to, it doesn't matter right now because this is not for points, but we're going to take a look at how the Kahoot's going to work. So I'm going to start this. And we're just going to do a practice round. And the first question of practice round is going to be a quiz question. So using your secondary device or your second browser, you're going to answer what year was the first aid course held in Canada, which was held in Quebec City. So using your secondary device, you're going to pick whatever color is which the answer is, okay? So you're going to pick red, blue, yellow, or green, or if you're colorblind, triangle, diamond, circle, or square. Once everybody that's registered has answered, it skips to the answer, and the answer is 1882. So it was red, triangle, great job. And then when I click on next, you'll see who the points went to. The faster you answer and the correct answer, you get more points. The next type of question you might see is a true or false. The eye hospital is in Jerusalem. The eye hospital is in Jerusalem. And not everybody's answered, but it's going to run out of time. And the answer is true. So looking at the points, you can see that you can raise up pretty quickly. So type the answer is where you use your actual keyboard to type in. Cardiopulmonary resuscitation is abbreviated as. And this purple circle over here is your time limit, what's left. Again, if everybody answers before the time limit, it goes directly to how you did. Okay, so we'll let everybody get in their answers. And not everybody answered, so it didn't go to the main screen. And the answer is CPR. How many people got it right? All 28. Pretty easy, right? So type in the answer. We all figured it out. And again, you can see how getting one question right a little bit faster can move you up into the top 5. The next type is a puzzle. Put these Knights Hospitalers' history in order from oldest to newest facts. So this one might be a challenge for some people, especially if you weren't a youth member and didn't get to attend a knowledge of the order. Again, this is for no points. This is just getting you used to putting things in order. Put these Knights Hospitalers' history in order from oldest to newest facts. So we've got 23 answers in. I'm going to skip ahead for the sake of time. And the answers are: they were founded. Blessed Gerard was appointed as the first master. They fled to Rhodes for the first time and established a new headquarters in Malta. So let's see how everybody did at the end of it. We've got third place was MC, great work. Second place was Kieran, and first place was Denise. Great job. So 4 out of 4 for all of them. Now I'm going to stop sharing for just a second. I'm going to give you the new PIN number into the chat again so that we can get ahead of it. And we're going to have everybody take a look. Here we go. So in order to move the order, you just apparently move it if you're using a phone with your finger, a touch screen. If you're using a laptop, just use your mouse, click on it and move it. You do not need to have your camera on. So with the order, like I said, touch screen, try and push, hold, and move it around. Okay, so everybody can see the PIN number. I'll start sharing again. And that way we don't have anybody join us that shouldn't be. Again, please use your full name. And you can see we're waiting for players 986173. You will be asked to enter your email address, and that's okay. So email address. That way we know where everybody's coming from, and your username. Great, we've got some people registering already. Let's get in and we'll get this competition started. There we go. Now folks are coming in. Excellent. Just give you another few seconds to get going and we'll get our questions started. Remember, this is the AMFR level. So the questions are going to be a little bit tougher if you happen to be watching the live stream from earlier. And these all come from the current AMFR textbook. Okay, so you should have learned this in your MFR course, or you could have been reading your textbook to get ready for this. Hint, hint for May. So we've got 21 people that are going to play. And off we go. Here we go. AMFR competition question level. AMFR question 1 is a quiz question. Use suctioning for up to blank seconds in an infant, blank seconds in a child, and blank seconds for an adult. We've got 21 players. Who's going to get to the top of the board already? How many seconds do we suction for an infant, a child, and an adult? We suction for 5 seconds for an infant, 10 seconds for a child, and 15 seconds for an adult. Central Conrad, great work. So fastest and correct. Quiz question. Anatomy, the patient suffered a blank injury which is less than 3 millimeters deep. What type of injury is that? The patient suffered a blank injury which is less than 3 millimeters deep.
Sorry to interrupt, but some of us are having problems getting past this reorganizing the screen, the patterns on the screen. Can you go over that again, please?
So it should be just click with your finger and move them in order. You haven't had one of those questions yet, so I can't fix it for you right now, but when we get to it, we'll definitely make sure that everybody's moving around and everything is working, okay?
So
No,
it's
I'm
actually
try-
stuck on the screen. Like it's stuck ever since like you signed in. It's just stuck on that screen, not in.
It says that you're nearly there. You got to match these
Pattern
patterns.
on the
Move on.
screen.
Okay. Are you currently in the right Kahoot? Because
Yes.
we
Yes.
haven't done one yet, so you shouldn't be stuck on that screen.
If you guys look at the bottom right corner, there's like a pattern that changes every 10 seconds. And if you want the pin, it's at the like bottom of the screen.
No, it's not the question. It's actually ever since we put in our email and put the name, it's stuck on the screen where he says you're nearly there. So we don't get to move on. Like it doesn't, and you can't answer it right now. It didn't join.
Are you in the app?
Sandra, did you lock the Kahoot?
I don't think it locks.
I'm
when-
online. I'm online trying to get it. There's no pattern to match to, and I
Okay.
can't switch things around.
Let me take a look here. If I can go back and
I think once you
stop
start
sharing
the
for just a
Kahoot,
second.
it's locked.
I was gonna say, this is the first time it's happened. We've run 2 successful so far without any issues, so.
So that's the screen
Yes.
that's stuck on.
And you haven't been able to enter?
No.
No.
Okay.
Nope.
You just need to click the pattern without moving them at that stage. I had the same issue getting in.
Okay.
Just try clicking without dragging and see if that works.
What's the
It's
pattern?
it's
that we
because
use?
Yeah, so
the pattern changes every 10 seconds.
Someone is saying click the boxes in order. You don't drag.
Okay. Well, that,
So Sandra, if you reshare your Kahoot screen, on the bottom right, there is a changing pattern every 10 seconds. So within those 7 to 10 seconds, you need to click those
Oh,
4
I see.
patterns. It will get you in. There we go. So at the very bottom, you see pattern green, red, blue, yellow. It's going to change within 1 second. Now you have a new pattern. So now blue, red, green, yellow.
okay. Yeah, you need to click on them. That's, yeah, that was the confusing part of the instructions. We're told to rearrange them.
I think that's the first time that has been like that.
Yeah.
Okay. So if you're on the computer, you just click them in order that you see. You don't have to rearrange them.
I'll be honest, I am not sure because every time I've played the game with some of the competition committee members and other people I've had check it, it's not been an issue.
So it's pressed in that order and it says get ready. You'll be able to join soon.
So I'm going to end the game. We'll get a new pin. as soon as I move this out of the way. And we'll start over again, okay?
Okay, great.
Hey,
Thank
can
you.
you give us time?
I can. The only concern is in the last event, we had somebody join from YouTube that wasn't welcome. So
Okay.
we were trying to keep the pin as secret as possible to keep people from joining in. So the new pin, so go to kahoot.it 5366698. And then you need to enter the pattern. Is everybody getting in now, or anybody having difficulty?
Not yet. One second.
So Sandra, you shouldn't have any problems with anyone joining from YouTube anymore because of the pattern thing that was turned on.
Yeah.
The live stream is delayed by 30 seconds, and the pattern changing every 10 seconds will mean that they'll never get it correct.
Perfect. I changed that setting, and I wasn't sure if that was going to be the case, so.
Yeah, that's what that's for. And that's why it changes so quickly. It's because the minimum guaranteed time of live stream delay is 7 seconds.
Okay, perfect. So is everybody in that wants to play? If anybody still wants to join, let me know, and then we're going to restart. Okay. And of course, the first two questions, you already know what they are. So hopefully we're going to be really fast with the answers and everyone's going to get them correct. So if you don't see your name there, let me know now, and I'm going to start if you don't, or if you don't have any problems. Everybody's in. So we've got 26 people. Okay.
It's like Jessica Moreira is still trying to sign in.
Okay. So we do have a time limit, so we do need to get going soon, as we're already now a little bit behind. Okay, we're gonna get going. Off we go. So again, everybody should know the answers to this first two questions. The quiz question of how long do we suction for an infant, child, and adult? Who remembers? Whoa, look at y'all go. Everybody remembers it's 5, 10, and 15 seconds. Good. Who answered it the quickest? Wow, we've got a tie for first place. That's the first time that's happened. Okay, next question. Hopefully you remember this one too. The patient suffered a blank injury that was less than 3 millimeters deep. Okay, what type of it? It's superficial. Okay, now we've got a new question. Andy's at the top. Type the answer. Normal breathing rates for an infant is up to how many breaths per minute? Up to how many breaths per minute is a normal breathing rate for an infant? We've got this little baby. Their respiratory rate is usually how many breaths at the most? Should have one more person that needs to answer. And the answer is well, we've got a variety. Up to 6 breaths per minute for a newborn infant. Super fast, 1 per second. Martha's right up at the top. Good job, Martha, you're on fire. Quiz question. Anatomy, the swelling to the casualty's face was isolated to the cheek, just blank to the left eye. So our anatomical positions, the swelling to the casualty's face was isolated to the cheek, just blank to the left eye. Here we go. And the answer is inferior. Good. So below the eye. Wow, we've got some movement. Top 5 has moved. Off to the next one. Which oxygen delivery device provides up to 90% oxygen and is made up with a reservoir bag? So we're going to type in the answer, which oxygen delivery device provides up to 90% oxygen and is made up with a reservoir bag? Which one? We don't use it very often anymore with the new oxygen standards, but when we need it, it's definitely important. And it is a non-rebreather. Excellent. So I've put in 4 different ways that people could type it in, as much as I could think of you could select. And what did we get? Sherry's at the top. This is moving. You guys are all over the place with the scoreboard. Great job. A puzzle. Trace the flow of air through the respiratory tract during inhalation. So air enters where and ends up where? The flow of air through the respiratory tract during inhalation. Mouth and nose, pharynx and the larynx, the trachea, bronchial tubes, and the alveoli. Sherry's on fire, but Denise, you were able to answer quicker. Great job. Quiz question. Your casualty fell 2 meters onto concrete. Which method is used to open his airway? You guys are so quick at answering. And it's a modified jaw thrust. Excellent. The suspected head and spinal injury gets a modified jaw thrust. Welcome to the top 5, Jessica and Andy. Next question is a quiz question. Your casualty is found unconscious on her bed. Which method is used to open her airway? Unconscious on a bed. And we've got the head tilt chin lift. If you need to check for breathing, head tilt chin lift. Wow, again with the movement of everybody. Excellent. A true and false. A nasopharyngeal airway is used to maintain the airway of a patient who has a gag reflex. So fast at answering. I am impressed, and it's true. You wouldn't use an oral airway because they would probably barf on you. Great job. David Meek, you are the fastest climber. Excellent. Quiz question. Generally, when assessing a pulse on a responsive adult, use what? Which pulse do we check on the responsive adult? The responsive adult is a radial pulse usually. The carotid pulse might be aggressive to grab at their neck, but if need be, it is the most correct. Next one, quiz question. A reading of the casualty's blood pressure can tell you what? A reading of the casualty's blood pressure can tell you what? And this is right from your MFR book. It tells you how well the organs and tissues are being oxygenated. Great. Do we have change? Peggy, welcome to the top. Welcome to the top 5. Type the answer. The abdominal cavity is separated from the thoracic cavity by what? You'll notice it's not labeled. And remember, spelling is important. So take a second and make sure it's correct before you hit to submit it. The abdominal cavity is separated from the thoracic cavity by what? It's missing out of this picture. What is the answer? It's a large muscle and it's the diaphragm. The diaphragm separates the chest from the stomach areas. Good. Catalina, welcome to the top. Okay, true or false? You must maintain a jaw thrust during artificial respiration of a patient with suspected spinal injury. True or false? Do we maintain the jaw thrust? And if you can, the answer is true. We want to keep their airway open, get the air flowing in and out. Madison, welcome to the top 5. Type the answer again. What is the most common cause of an airway obstruction in the unconscious patient? This fella is unconscious. We do a head tilt chin lift or a modified jaw thrust, depending on the mechanism of injury, but why are we doing it? The most common cause of an airway obstruction in the unconscious patient. It's part of the anatomy. We've got 5 seconds left. And Gene Simmons had a long tongue. So the tongue is the answer. Wow, no movement of the top 5. Let's keep going. Quiz. What is the CPR hand position for one rescue or infant CPR? You're all by yourself. What are you going to use to do CPR on the infant? Wow, I can't believe how fast you guys are answering. 2 fingers just below the nipple line. We go just below. Excellent. We had a little movement in the top 5. Peggy's moving up, but Kit Lowe has come back with 3 in a row. Great job. What is the compression to ventilation ratio for one rescue or CPR on a child or infant? So you're all by yourself, a child or infant, and use the bracket, number, colon, number, bracket. So you can just use that, or you can just use number, colon, number. Compression to ventilation ratio for one rescuer CPR on a child or infant is, we're almost out of time, and it is the same as an adult, 30-2. Excellent. Moving on up. Andy T and Maria, welcome. Top 5 quiz question. Which statement is false about the pulse? Ooh. Make sure you read them. Which one is false information about the pulse? There's one that should stick out to you because it is false. It's wrong. Which one is it? And the answer is that the heart rate actually should be between 60 and 100 for the adult. Wow, excellent. We've got some movement again. And again, Central Conrad is the highest climber. To determine pulselessness in the adult, assess what? So in order to determine if they have a pulse or not, when you first arrive on scene, where are you going to check for it? Hint, it's in the picture. And watch your spelling, make sure it's right. To determine pulselessness in the adult, assess the what? The blank. 3, 2, 1, and it is the carotid pulse. So the carotid pulse, let's see how everyone did. Sajid, welcome to the top 5. Quiz question. The correct landmark for one rescue CPR compressions on an infant. Now that we've already talked about this, you're all by yourself. Did we change the answer? One rescue or CPR compressions on an infant? Which one is it? There we go. Just below the nipple line. Don't forget that one. It's super important to be in the right spot. Wow, Jessica, moving up. Let's catch, Denise. Let's catch. Okay, type the answer. At what age minimum can an AED be applied? At what age can we start using an AED? So they did lots of scientific studies on above this age group and not so many below this age group because most parents won't donate their children to give it a go. And it is 30 days. So you can use an AED between 30 days and 1 year of life for the infant. Okay, we didn't have movement of the top. Quiz question. You arrive at a cardiac arrest with CPR in progress, the AED sitting beside the VSA patient. What do? You need to put them in order. So what is our order? The AED is sitting beside the vital sign absent patient. You guys are quick, and it's turn on the AED. What do we want to do? Of course, get the AED turned on so we can listen to the voice prompts. Excellent. Keep moving a puzzle, move them around. The AED is advising a shock. Put the sequence in order. So you've now turned it on. What is the order it's going to tell you to do? The order to help resuscitate the patient, those voice prompts are going to tell you to do what? We're almost there. We almost have everybody in. It is make sure everyone is clear, deliver the shock, resume chest compressions immediately, and perform 5 cycles of 2 minutes of CPR. Gone are the days where we did CPR for 2 minutes before we turned it on. So if anybody here is old like me, you might remember that, but we need to get that AED on right away. True and false. Best practice is to treat the mechanism of injury of a spinal injury regardless if they do not have any signs or symptoms. So it's best practice to treat all patients as if they have a spinal injury, regardless if they have any signs or symptoms. And the answer is true. So you may not know if they've fallen from a ladder or from a height, but we need to assume that everybody has a potential head and spinal injury until you can determine that wasn't the case. Abir, you're moving up again. Great job. So here we go. This is an introduction. You and your partner are called over to a car where a man has grabbed his chest and slumped over the steering wheel. Bystanders have pulled him out and are starting good CPR. It is safe to approach. Your partner has assessed the patient while you set up the AED. The patient continues to be vital sign absent. Based on this scenario, we've got 5 questions. Type the answer. When you open his shirt, there's a nitro patch on his upper chest. What should you do? So there's a nitro patch where we want to put the AED pads. What do we do? There we go. We remove it. Oh, you guys went super detailed. Wow. Okay. We've got movement again. Next question. The AED indicates a shock. Before you deliver the shock, again, what do we want to make sure? The AED is delivering a shock. We need to make sure no one's touching them. Be safe. Safety first. We've got some movement again. Quiz question. After delivering 2 shocks, you receive no shock indicated. If needed, begin CPR. What do you do? No shock indicated. If needed, begin CPR. What do you do? You start CPR or check the ABCs because they could be alive. Great job. Make sure they're not dead before you start CPR. Type the answer. The patient has a pulse but is not breathing. At what rate is artificial respiration to be administered? Number, colon, number, hyphen, number. 1 breath every how often? One breath every how often? Hint, hint, just told you part of it. Artificial respiration for the adult. And it's 1 breath every 5 to 6 seconds. There we go. Moving up. Madison's moved to 2nd place. Keep going. True or false? While performing AR, the patient presents with a gag reflex. It is best to use an NPA to maintain the open airway. You should know this one right away. So you're doing AR. They're not dead. Artificial respiration, they have a gag reflex. It's best to use an NPA to maintain the open airway. And going to be out of time. And it is, of course, true. We talked about the gag reflex before. We don't want them to barf on us. We've got a poll for you. This doesn't count for any points. I just want to know, is this enjoyable? What are you thinking about Kahoot, how we're doing this today? And the answers, I just want to take a quick peek. Okay. True or false for points? When relieving an airway obstruction in a conscious adult, you should alternate between back blows and abdominal thrusts. Choking conscious adult, back blows and abdominal thrusts. True or false? It's true. Unless they're too large for your arms to get around, in which you would use chest thrusts. Kitlo Lamb, streak of 8 in a row. Excellent. Next one, true or false again. An 8-month-old conscious choking is relieved with back blows and chest thrusts. An 8-month-old conscious choking is relieved with back blows and chest thrusts. And the answer is true. Just like the patient who is too big for your arms to get around, this one's too small. So we're going to use back blows and chest thrusts. George is making a comeback. Moving on, type the answer. To determine pulselessness in the infant, assess which pulse. Remember, take a second and type it correctly. To determine pulselessness in an infant, assess which pulse. The hint is in the picture. What is that pulse point called? Almost there, just about out of time. And it is the brachial artery. The brachial is the upper arm. Excellent. We wouldn't check carotid in an infant because their neck is too tiny. Okay, moving on. Quiz question. You determine the unconscious casualty is breathing inadequately. You should do what? You determine the unconscious casualty is breathing inadequately. What do you do? We've got a couple more people to answer. We begin ventilating immediately. That's right. Oh, our top 5 are moving around their place a little bit. True or false? The normal pulse range for an infant is between 120 and 150 beats per minute. The normal pulse range for that little fella is between 120 and 150. True or false? And the answer is true. Infants have a fast heart rate. Excellent, Maria. Welcome back. Repeat the ongoing assessment every how many minutes for an unstable casualty and every how many minutes for a stable one. So we repeat the ongoing assessment, such as vital signs, every blank for an unstable casualty and every blank for a stable one. Almost there. We've almost got everybody answered. And the answer is for an unstable casualty, recheck every 5. For a stable one, every 15 at the least. You can, of course, check it sooner than that. Quiz question. A splint is made from any available material that can immobilize an injured limb. Is a blank splint. What type of splint is the one that's made from any available material? It is a, one more person to answer. It is an improvised splint. Anything you can find is an improvised splint. Jessica's moved up. She's 4th place. True or false? A cervical spine injury can result in severe breathing problems or even respiratory arrest. So in this x-ray, that is a very bad cervical spine injury. Could this make a person have breathing problems or even respiratory arrest? And the answer is, of course, true. The answer is true. Where we get the innervation to breathe comes from our brain, but to move our muscles, it comes from the chest. True or false? The lack of back pain, inability to walk, move arms or legs, or feel sensation rules out a spine injury. So this guy's falling off his motorcycle, maybe at a high speed. He doesn't have any back pain, he can move his arms and legs, and he can walk, he can feel sensations. Does that mean he doesn't have a spinal injury? No. Look at the mechanism of injury too. Excellent. Wow, our top 5, we've got 3 people that really moved up the standings. Quiz question. Your casualty has a closed ankle injury. To check the distal pulse, use posterior blank or dorsalis pedis pulse. Dorsalis pedis pulse. You want to check the distal pulse where? The posterior blank or the dorsalis pedis pulse? Posterior, where could we check? Posterior tibial, excellent. Our top 5 haven't changed, but Martha, you're in the game. Keep it up. Type the answer. Remove a helmet from a suspected spinal injury casualty requires at least how many rescuers? To properly remove a helmet from a suspected head and spinal casualty, it requires at least blank rescuers. What do we have? There we go. We need at least 2 rescuers. Sorry about the spelling one of the number 2. I didn't think to put that in. I apologize. True or false? Manual stabilization can be released when a patient has been properly secured to a backboard. Holy cow, look how fast you guys are answering. Manual stabilization can be released. Of course it can. Once they're secured, that's okay to release that support. Peggy's in the game as well. 3 in a row, moving on. Quiz question, control bleeding from an amputation, you should first use what? This is basic first aid. To stop the bleeding, of course, direct pressure and elevation. We've got 4 people that have 6 in a row. Excellent. Quiz question, which of the following crush injury sites would be most likely to result in shock? Where does the shock come from with a crush injury? What's the most common place? It can also lead to compartment syndrome. The most common spot is the femur. Excellent. It's the large muscle mass. It can have a lot of bleeding resulting in hypovolemic shock. Quiz question. What is the CPR hand position for to rescuer CPR on an infant? To rescuer CPR on an infant, we use what? This one changes from the one rescuer that we've already talked about, made sure that we knew exactly where to put it. And it is 2 fingers just below the nipple line. It should also be encircling the chest. Sorry about that one too. We've got a little mistake in there. Our top 5 didn't change. Type the answer. What is the compression to ventilation ratio for to rescuer CPR on a child or infant? Okay. Don't put the brackets this time. Number, dot, number, or number, colon, number. What is the compression to ventilation ratio for to rescuer CPR on an infant or child? We already did 1 rescuer. Now we're doing 2 rescuer. Number, colon, number. And it is 15-2. And remember, children and infants usually die because of a respiratory issue. We want to give more breaths over the span of a minute. True or false? The laryngectomy creates a stoma, an opening at the base of the neck, which could be used for AR or CPR. A laryngectomy creates a stoma at the base of the neck, which could be used for AR or CPR. And the answer is true. That hole in the neck, if it's there, you need to use that instead of the mouth because the air will just come out. And finally, our last question is a puzzle. This one's nice and easy. The order of emergency scene management. The order of emergency scene management from standard first aid and MFR. What is it? There we go. Scene survey, primary survey, secondary survey, and ongoing casualty care. Let's see the standings. What do we have? 3rd place, Madison. 2nd place, Central Conrad. And 1st place, here we go. It is Denise. Excellent, excellent job. So I'm going to stop sharing. There we go. Yay, everybody. So thank you again for attending. This one was a little longer than the other ones because, of course, your AMFR, we figured we could challenge you a little bit more. You will get an email at the end of this event from Dawn. Wave Dawn. There's Dawn, and he's going to ask you to complete a survey. We want to see what you thought of it because our May event will be based likely on a Kahoot. So I haven't started writing yet. I need your input. I'm going to turn it over to Dawn now.
I hope you've enjoyed the 2021 virtual OMFRC. Thank you and congratulations to all of the competitors. And thank you to Paul and his team, the competition committee, for putting this day together. This past year has been one of many challenges and some innovative changes for the organization. Early in the pandemic, we struck the Public Health Advisory Task Force, which has been guiding us since the beginning. Our therapy dog program adapted to window and then virtual visits. Our MFR volunteers have been participating at COVID assessment centers, shelters, and other community operations across the province. Most of our other programs have adapted to some form of virtual engagement. We successfully hosted our first virtual conference in AGM, and our next conference is coming up soon in April. We also know that this pandemic has posed some challenges, and I'm pleased to say that we've updated and reintroduced our Critical Incident Stress Awareness Program, and we have some other member wellness initiatives underway. Like most of you, I really look forward to the day that we're able to come together for events like this, our AGM and investiture, our conference, and even our regular meeting nights and training. In the meantime, stay safe, wash your hands, wear a mask, and keep looking out for each other. We'll get through this soon. Finally, once again, on behalf of the Standards Committee, I'd like to congratulate all the participants and thank Paul and his team for putting this day together.
My name is Paul Sims. I'm the chair of the Competition Committee for Ontario. I am so pleased with the number of participants this year in this zone. The entire Competition Committee hopes you enjoyed the format, and I would like to thank each and every one of them. Don Smith, Sandra Ladd, Robin Innes, Anthony Chu, Lynn Tejo, Marcia Sens, Russell Walters, Nancy Hutchinson, Harvey Fields, and of course our admin staff, Claire Akinoid and Chris Schmidt. The Ontario Medical First Responders Competition, which is scheduled for this May 2021 is going to be virtual again as well, thanks to COVID. We are hoping for a better situation in 2022. Keep logged on to omfrc.ca for further details. Thanking you once again for participating in our very first virtual competition. Remember to be safe, wear a mask, maintain social distancing, and of course, wash your hands. Thank you.
Thanks, everybody.
Thank you very much, people, for participating. That was really great. I will be sending an email to everybody today seeking your feedback so we can make this even better.
Thank you.
Thank you so much.
Thank you, Sandra and the OMFRC committee. Great stuff.